Hi, Miss Gail. How you doing? Shakaya Black here. So I just wanted to start off with making this video first, just to show you all the supplies that I am going to be using. Of course, I have my gloves. Please excuse this alcohol wipe. Believe it or not, I did not get not one in my kit. So please excuse that, but that was one that I had actually found. But I know that's part of when I am cleaning and administering, but we'll get there in the video. My sharps container, I have my flushes, hand sanitizer. Here is the sodium chloride 500, the sodium chloride 50. Here is the IV kit. And here is my arm. I do have it connected already. There's the bag where the sodium chloride is going to be connected. My patient has two identifiers and her name band with her date of birth. This is the makeshift arm. The reason I did it like this, unfortunately, was because I was not able to even find the photo of the arm online. And then when I did find it, of course, my printer, it just wouldn't print. I was having some problems. So just to show you, obviously, this is where it would be connected, and then the Tegaderm would obviously go over the site to protect it. And that's it. I'm just showing you this video first, and I will be moving to the next one. And obviously, I know that when I am doing this, I will be in scrubs. Hand hygiene will be performed, and my hair will be pulled back. So I will see you soon. I did just open my two bags, and I just want to give some information on this prior to moving forward. So the first thing I'm going to do, obviously, is check the expiration date on both of them. They are both still very good. As I am inspecting both of them, I am looking for any types of discoloration. I am looking for any type of particular matter that may have developed inside of the bags. Both of the bags look very good. Now, when I do get these, prior to hanging, I will be labeling them with the date, the time, my initials, the prescribed rate, the time they start, and the time that they should be ending. So I want to make sure all those factors are on the bag. Obviously, I'm going to do the 5 rights and things like that prior to administration. But right now, I just wanted to just discuss these 2 bags for right now, that I need to do my nursing checks ahead of time to make sure the safety of the patient is maintained. Okay, so I just wanted to make that short video too. Okay, so the next thing I want to do is I want to spike this bag. So I'm obviously going to open this. Hopefully it's filming okay. I'm obviously going to open this. I'm going to start with my 500 cc sodium chloride bag. Now, a little trick that I've learned since I am IV certified is that sometimes this little label right here, you can save it. This little label, you can save it and you can use it to label the tubing. The first thing I'm going to do is make sure all my tubing is unraveled. A little bit of a jam here, but I got it. All right. Now, bring down the clamp. We don't want any spillage anywhere. Then we're going to remove this off of the bag. Okay? Then we're going to remove this cap. Keeping sterility. We want to keep this clean. Put it inside here. Make sure it's in there good. Now, my 2 poles just happen to be on the other side of me. Now, I am going to hang them up there just so you can see that I am doing it properly. But once I hang it up there, I will squeeze, fill up halfway as it's hanging, open the port, make sure it's going down. Any bubbles in there, I will flick them out as they're going down, because we don't want bubbles in there, because depending on the type of machine you use, if there's any bubbles, it's going to beep like mad, and we don't need that. So we want everything to go obviously smoothly. Now, when I do hang this on the pole, well, the makeshift pole I have, once I hang it up there, I will make sure to label it with the date, the time, and my initials. So I'm going to do that just for video purposes to show you that it is going to be up there. And I will be right back. One other thing before I do hang this, I forgot to mention, this cap I am going to save because I am going to need. And I just wanted to show you this. As you see, I do have it hanging up here on my makeshift IV pole. So now it is all primed, and I put the cap back on just for sanitation purposes. So I just wanted to show you that it is primed. I just have it hanging next to my couch, but it is primed, and I made sure there were no air bubbles in it. I don't know how good you're going to be able to see it, but it is primed. I did put the clamp back down because we don't want to waste any medication. Other thing, label. Label is up there. I just wanted to make sure that that was up there with the date, time, and initials. I didn't write it, but that's what would go up there. Okay, so now we are moving on to the actual, I'm sorry, my Tegaderm fell off, but I know how to put, I know the Tegaderm goes up there for protection, but I've got my arm. So now we are going to move into the section where I'm actually starting to administer the patient's medication. So the first thing I'm going to do, I'm going to make sure I verbalize the 5 rights. Right client, right time, right dose, right medication, and the right route. I have verbalized all of that. I have my 2 identifiers. I know that this is Miss Ellen Davis. She is alert and oriented ×3. She was also able to tell me her first, last name, and her date of birth. Okay. I did look at her chart prior to me even getting anything, even going in the room actually. And she has no known drug allergies, but she is allergic to pollen, but that's okay because we don't have any pollen in the room. At least hopefully we do not. Now, I would then perform my hand hygiene, gather all my supplies, get my clean gloves, my fluid bag, which is obviously ready to go. I would provide privacy, obviously closing the door and making sure everything is okay. Again, I would check the fluid bags just for safety reasons, check the expiration date, just make sure everything is in order and ready to go. I know that I did do that earlier, but it doesn't hurt to do these things and to definitely make sure you do them ×3. I will proceed to do that, and let me just make sure that my camera is not dying. Hold on one second. My apologies. It looks like my camera's dying a little bit, so I just wanted to make sure that was all said and done. But let's get right back into it. So I have my patient here, Miss Ellen Davis, date of birth 9/1964. The fluid that she is getting is sodium chloride, so it is going to be administered at 125 cc's per hour on a continuous basis. Each 100 milligrams bag has 900 milligrams of sodium chloride in it, okay? And I would obviously, again, like I said prior, check this by doing the rule of 3. I already mentioned her identifiers. Again, she is alert and oriented, so she is able to do that. So I want to make sure I make this clear because I'm not 100% sure if I said it, but I know that I do need to do it. In between setting up the IV itself with the bag, I will do hand hygiene. So I would hand hygiene, do what I needed to do with the sodium chloride, hand hygiene, come back and assess my patient. So as of right now, I am doing hand hygiene. Again, I did already do the bag and everything prior. I just did it a little differently because of my camera. It's hard for me to just film everything, but that's what I would do. So now that the bag is set, the patient has been identified, is ready to go. Now we're going to start moving into actually assessing the site. So I would assess the site, make sure everything looks good. Make sure I don't see any phlebitis, make sure I see no swelling, nothing that would draw concern to me before administering this IV to the patient. So I would obviously take my alcohol pad, rubbing the, well, after the site is clean, obviously, cleaning the ports, making sure that's good, cleaning the port here on the patient's arm, making sure that is good. I'm hoping I'm in focus. And obviously then connecting immediately, because especially, again, me being IV certified, you know, you're going right into somebody's bloodstream. So you got to make sure that this is as aseptic as possible. You really have to keep everything clean. So I would then do this. I'm just unclamping everything and putting everything together. Wait a minute. Hold on here. This actually goes the other way. My apologies. This goes this way. Okay. So once this is all set, now obviously, if this was in already, that would have not happened, because whoever put that in it wouldn't go in the other way. So this is here ready to go for the sodium chloride to then come down. Once I have inserted and secured the tubing with the connector, I just want to make sure everything is all set and done. I would then remove my gloves once I start the infusion, making sure that it's running smoothly. And I personally like to stay for about a minute or two, because if there are any bubbles in there, the machine's going to beep. It's going to go off right away. So once I do have the patient set up, I would then remove my gloves, perform hand hygiene. Again, make sure that the clamp is open. So I'm going to open the clamp over there. And again, the way my camera is set up, I can't reach it, so I'm going to go over there. But I would open the clamp before turning the machine on, making sure all clamps are open, because at times, sometimes you do have more than one in different places. I would go into verbalize the rate. Again, the patient is getting 125 cc's per hour of sodium chloride. So make sure that is done. Once the patient is all done, I will see how she tolerated it. You know, maybe she didn't like it. You know, there could be a problem, but any adverse effects, I would obviously document it in my charting and take it from there. We will take it to the next step. So that's it. Now, I did want to show you one other thing, that the infusion actually is working, and there's some fluid. My patient is getting her sodium chloride. So I just wanted to show you that. Okay, bye-bye.